Hi, my name is Ruth Schwendinger, and I get to be a program coordinator with Prevention Network. I am coordinating the Coalition Support and Community Change program, and tonight we're focused on building capacity at the coalition level, with our topic being policies and practices. When we're talking about specific policies and practices, we want to focus on why we're doing things the way we are, and recognize that it's important to approach that in a culturally sensitive way, because we are all part of a system that has historically marginalized people, silenced voices, eradicated cultures, and undermined the human value of people from non-dominant cultures. And many of our systems are still devaluing people today. And when we're going out into our communities and trying to reach new people and grow our coalitions, we need to be conscientious of that fact, because we need to overcome that as a barrier. And it's our job, because we're recruiting people. We need to create a culture of welcomeness, inclusion, and openness, where we value the voices of all people in our communities. So when we're taking a look at policies and practices, we need to come at it with the understanding of cultural competence and cultural humility, recognizing that our dominant culture has created the systems in which we're working, and that continues to impact how people interact with us on a regular basis. So my name again is Ruth Schwendinger. My email address, ruths@preventionnetwork.org. My desk phone, 517-898-6078. I want to talk a little bit about where these ideas come from that we're talking about tonight. And so zooming out, the Department of Health and Human Services on the national level has created SAMSA. And SAMSA is an acronym. It stands for Substance Abuse Mental Health Services Administration. It was created in 1992 by an act of Congress, with the sole purpose of advancing our nation's behavioral health. So there are a lot of resources on samsa.gov where we can do these items on the right. So we can connect to treatment. We can access training modules through the PTTC, or the Prevention Technology Transfer Center. We can access public messages that our federal government has for our citizens about behavioral health care. We can access grant opportunities and find notices of past grants and find out what other people are doing. We can take a look at the national data that is the most recent data that's available at the national level that SAMSA has compiled. We can access different programs. So SAMSA continues to publish evidence-based program guides, and those are programs, policies, and practices that are evidence-based, and we would use those and bring them and implement them with fidelity in our communities. So many of those are, the evidence-based practice guides are focused on a specific topic or tool. So I encourage you to explore those if you are encountering a specific challenge locally. They have their newsroom for notices, public notices, and then finally publications, which can be really useful if you're looking for some talking points for your community members to take into their conversations, to advocate for your purposes. So under SAMSA, Substance Abuse Mental Health Services Administration, in 2003, CSAP was created, and CSAP is the Center for Substance Abuse Prevention. And it's a division of SAMSA, which was created under the Department of Health and Human Services. So again, we're digging into acronyms a little bit tonight, but CSAP was created in 2003, and they have identified these 6 strategies for prevention work and for substance misuse prevention. And we're using these in our Coalition Support Community Change program. We're highlighting 3 of the 6 for this program, but I want to give a brief overview of all 6, because any prevention work should be comprehensive and include as many different levels as you can effectively implement. Because with our water wheel analogy, the more contact we have at different levels, the more we're going to be able to shift things, the more we're going to be able to change what's happening in our communities. So information dissemination is a part of just about every prevention coalition work that I've seen. So it's one-way communication. It is, here, let me tell you something about what's relevant to you with substance misuse prevention. So that differs from education, because education is two-way communication. Education often happens when individuals are building a knowledge base or developing skills that are relevant to substance misuse prevention. If we're encouraging people to develop skills of problem solving or conflict management, that would be parenting skills. Those would be examples of education type strategies. Alternative strategies is one that we're focused on with this grant. And it really focuses in on providing alternative activities to substance misuse or alcohol misuse. And so what we're looking at with alternatives is something that might be swimming lessons or a free day at the pool or the reading programs at our local libraries. The summer reading programs are a great example. A lot of our recovery groups in Michigan are excelling at offering alternative activities like dances and game nights. But I do want to point out that 2 of the 3 we just talked about are not effective by themselves at substance misuse prevention. So I already said we need a comprehensive approach. Information dissemination by itself has not been proven effective at substance misuse prevention, nor have alternative activities. We really need a combination of multiple strategies to be able to affect change. So alternative activities are good, information dissemination good, education good. The next one is problem identification and referral. So problem identification and referral as part of the 6 CSAP strategies talks about identifying a subgroup of our population that has experienced personal use of alcohol or substances. And so those people who have indulged in use might be referred to what we would call diversion programs. Oftentimes, if there is an underage person who has been pulled over after drinking, they would experience having a DUI, they would go through the court process, and then they might be referred to a diversion program, which would include education. But because it is a subgroup, it fits under this strategy rather than education. So problem identification and referral might also be used in schools. If you have a young person who has been caught using a vaping device on school property, you would confiscate that device, hopefully dispose of it properly, and then encourage that young person to engage in some more education services. So I think that's happening in a lot of our schools. The prevention part of this is identifying that subgroup, that subpopulation, and then referring them to treatment. So treatment is not included in the 6 CSAP strategies because it's not prevention. It's farther along in the spectrum of care, in the continuum of care. So problem identification and referral is good for that subgroup of people. Community-based process is another one of the strategies that I want to talk about. And this one I feel is underused, or it's not often used effectively, because a community-based process really is based on the same foundations as coalitions. So a community-based process is one in which people from different organizations, different sectors come together with a similar goal or a similar purpose. And we build strategies and we incorporate and we integrate what's happening there to really create a prevention-oriented system. So we have the Office of Recovery-Oriented Systems of Care, and recovery-oriented is fantastic, but we feel that there's a lot more value in prevention than in recovery. We understand that the economic costs are a lot higher if we're intervening at a point where we're supporting recovery than if we're intervening before it gets to a point of a diagnosable substance misuse disorder. And so we really value prevention. And when we have a community-based process, then people are receiving prevention messages from all of the different places where they interact with people. So at the grocery store, at the school, at the doctor's office, at their parents' friends, their friends' parents. And we really can see at a community level when there is a comprehensive approach for prevention. So community-based process involves integrating systems with the purpose of substance misuse prevention. Environmental strategies are ones that affect everyone in an environment. So it could be increasing lighting and security at a local park, or it could be something like implementing a policy where we are monitoring use a lot more effectively. And so environmental strategies really affect everything in the environment. They affect everyone equally. So for this program, we're focused on alternatives, community-based process, and environmental, but we recognize that all of these are useful, and we want to address as many as we can effectively. We don't want to take on too much, but tonight I want to focus a little bit more on the community-based process. Okay, you followed along with me so far on acronyms. We have DHHS, the Department of Health and Human Services. We have SAMSA, the Substance Abuse Mental Health Services Administration. We have CSAP, the Center for Substance Abuse Prevention. And finally, we're going to talk about CAPP. So CAPP is the Center for the Application of Prevention Technology. And CAPP has identified these 6 capacity building factors because we want to focus on what we know works. We're going to build off of what others have already done so that we're not recreating the wheel. And remember that the importance of approaching this from a point of cultural humility, from a point where we understand that there has been historic trauma for certain groups, and that affects everybody in the system. And so really understanding and coming in with from a point of humility. We need to listen to people whenever they are brave enough to talk about what their experience has been with prevention, with mental health services, with substance misuse. And when we do that, we broaden our understanding, we strengthen our base, because my perspective, I can only offer solutions that I have experience with or that I've learned from others. So when I learn more from others, I can learn not only what's worked for them, but how to avoid mistakes that they have made as well. So really, capacity building is about learning from others, growing your base, continuing to build on what you've already learned and find more effective ways to do those things. Back to our water wheel analogy, if your water wheel is spinning, but it's not touching the water, you're not going to actually produce any energy. So when you in this analogy are the water wheel, your community is the water, and your coalition are the parts and pieces of the water mill that you are connecting together. When we're talking about this, we need to get into our community. We need to have more contact with people who are not already a part of our coalition. And when we do that, we're going to have a bigger effect because we're moving more water, we're touching more people. But that happens when we have more people involved in our coalitions. So our coalitions are going to be able to build capacity when we do these 6 things. when we when we have formal linkages and we have an organized structure. A water wheel isn't going to work if all of the gears and levers are piled loosely. We need to have structure. We need to have them connected in ways that make sense. In prevention work, we understand that there is a lot of overlap. And so the more we integrate our services, the more we integrate and combine our efforts, the more effective we're going to be. So types of structure and formal linkages. So we talked about that a bit last week. If you would like some one-on-one help about figuring out how to tweak that structure so it's more effective, or how to recognize those overlaps of services so that you're being more effective, and you can contact myself or Joel Hefner. We're available to provide some technical assistance one-on-one, and just send me an email if you'd like to talk about that. Those formal linkages are often in partnerships. A formal linkage is more than a general understanding. There would be a piece of paper with clear expectations written out for all parties involved, and then a signature with a witness. And so formal linkages really are capacity building factors because it doesn't change when you have turnover. The second capacity building factor here is the presence of champions. And we've talked about passion before. We've talked about the importance of having people who are passionate about your mission. And these often are people with lived experience, but sometimes not. And it's really important to have a champion who is well educated, who understands the core concepts of prevention, who understands the 40 developmental factors, who understands what best practice is, who understands that simply sharing your story is not enough, that we need to do so in a trauma-informed way. We need to do so in a way that decreases stigma, and we need to do so in a way that invites other people to join us. So the presence of a champion is a capacity building factor. And I don't want to put this on you as coalition leaders. You don't have to be the champion. You don't have to provide a champion. One of the things that you can do as a coalition leader is to help develop champions. And the more you have, the better, because the passion breeds passion. And so when you have someone who's on fire for your mission, they can stir up the excitement about your mission and your programs with other people and draw others to them. So the presence of champions is important for capacity building because it draws other people in, it keeps people on fire, it keeps people motivated, and it builds momentum. Effective leadership. There are multiple parts to effective leadership as a capacity building factor. Specifically, an effective leader understands the strategic planning framework, the SPF, the strategic prevention framework, and that's really one of the core concepts of this program that right now everyone in Michigan should be focused on the strategic prevention framework. And when you are understanding that program, that framework for doing prevention, it talks about what your next steps are, and it is a continuous process. So in addition to having that knowledge and understanding of the SPF, an effective leader is one who can plan, who can communicate. So an effective leader has vision, a clear vision and a clear mission. And an effective leader is someone who can communicate clearly and is organized. So that's multiple different parts of effective leadership. But I would encourage you to try to cultivate that within yourself. And if you don't have all of those skills, that's fine. Build a leadership team, right? Find co-facilitators, find people who would be willing to serve in an advisory capacity, who can advise you in certain aspects of leadership. So you don't have to have all of those abilities in one person, but an effective leadership team can be just as effective as a single leader, and oftentimes is more so. So I would encourage you to constantly be trying to develop leadership skills within your coalition, so that if something happens to someone and there's a change in position or role, that someone else is ready to step into that fit. And that talks about sustainability, which is also a part of the strategic prevention framework. And really, we want to have a succession plan for our coalitions, because if you are a coalition leader and you've been leading this coalition for 15 plus years, consider if you want your mission to continue and to grow after you've left. And really consider if things are going to be able to continue, if the roles change, if the funding dries up. Figure out a way to have effective leadership, and the more dispersed that is, the better. Fourth capacity building factor is resources. Do you have people involved? Do you have funding to do the things that you want to do? Do you have a meeting location? So this program is one part of the coalition support and community change program is offering mini grants of up to $50,000. If you haven't applied yet, or if you haven't looked at the application, there's very few eligibility requirements. So we're asking for you to have a mission that addresses substance misuse. We're asking for you to be a coalition in Michigan. We're asking for you to have an annual operating budget of under $250,000 and to have 2 or fewer full-time staff members or the equivalent. So capacity building factors, if you have resources, that's a capacity building factor, because when you have the time and energy to be able to go out and get more resources, you are at a distinct advantage. So I would encourage you, if you haven't looked at that application yet, to apply if you're eligible. Next is administrative policies and procedures. So again, we talked about having that structure in place so that if there's turnover, you're covered. Like, everything doesn't come to a screeching halt if roles are changed. Having those administrative policies and procedures in a written format and communicated to those people who are affected by them is really important. If you don't have a place to keep records, I would encourage you to take a look at what some of the options are online. Sorry, my throat's getting dry. So having those administrative policies and procedures in place, clearly written and clearly communicated, is a capacity building factor, because if people already know what they're supposed to be doing, then they don't have to second guess themselves all the time. So having clear expectations can help the water wheel move a lot faster and a lot smoother. And then finally, expertise. If you know what you're talking about with substance misuse prevention, if you know how to communicate with other people, if you know who else in your community is doing similar work, if you know how to grow capacity, if you know what trainings are available, if you have that expertise, people are going to listen to you. And so that is another capacity building factor. So when we're approaching our policies and practices in a culturally humble way, we understand that they are going to be most effective when they meet these 5 criteria. They have to align with your needs. If I have a policy that says, okay, we're taking youth on a trip for a training, my policy is that there's always a group of 3. There's never an adult and a student alone. So our policy would be 3 in a group at all times or more. And that aligns with our needs. So practices would align with our needs when they provide allowances for transportation to and from locations. If we have a strict policy or practice in place that we are not allowed to transport individuals in our private vehicles, then I would be limited in my ability to work with youth who are not able to transport themselves. So we need to recognize what our current needs are and make sure that our current policies address those needs. The second key factor here is positive relationships among key implementers. And this is important because everybody needs to be on the same page about policies. For people who are implementing the practices of your organization, we need to understand and interpret them in the same way, and then we need to apply them in the same way so that we are all meeting the same benchmarks and we're all doing things in a way that is consistent with the way our policies were intended to be implemented. So positive relationships are important because it allows for individuals to self-correct when they notice someone doing something differently from the way they're doing it. It allows us to self-correct. It allows us to, with confidence, approach someone else and then offer them correction and grace. The third key factor here is successful implementation. When we're implementing the practices of our organization, we need to do that in a way that gets the results that we're looking for, and that leads into effectiveness. So if we are offering a parenting class, we need to successfully implement that in order for it to be effective. That means we're not skipping lessons, we're not letting everybody out early by half an hour every week. We really need to follow with fidelity the program as it was laid out. And then effectiveness, if what we're doing is not being measured to be effective from start to end, we need to figure out why and address that. Because sometimes, even when we're implementing evidence-based practices and programs, something is different in our community than it was in the community where it was proven to be effective. And so we really need to understand if it's being effective in our communities or not, and then address that in the next round of evaluations or sooner, because if we're not being effective, then we need to change as soon as possible. The final key factor here is ownership by prevention stakeholders. Effective policies and practices shouldn't be just collecting dust on your shelf and shaken off and looked at once a year for people to sign off. It really should be things that are integral to the daily work that you're doing with prevention. And so when we're doing prevention effectively, we're collaborating with other people. We are constantly finding ways to integrate our work with what others are doing, because then we're building momentum, we're working together. We have more people at the table, we're going to have a bigger effect. And so when we have a shared ownership by everyone who's doing the work in our practices, they want to see us doing well, we want to see them doing well, because we're all working toward the same goals. So those specific policies that everybody should have are kind of listed here. The bylaws are separate. Bylaws are something that each group should have initially created that fits their needs. Bylaws are not changed frequently. It is something that you should have that sets the roles of who is going to do what, how many members are on your board, how often they meet, how you bring on new board members, who's responsible for financial management, who's responsible for employee management. So bylaws are not something that changes on a regular basis. The rest of these are policies and practices. And so every group should have a basic employee management policy if you have employees, which would state, who's responsible, who holds those people responsible, who do you report to, what are your main roles and responsibilities. So an employee management policy, how do you bring on new employees? Financial policies is another sector that every organization should have written down, even if you have a fiduciary agent. Your board, your membership should have some oversight, some understanding of what's happening with the financial situation, with any funds that come in and go out. You should have regular reporting at your meetings about your financial status. So those policies should also include insurance, because if you're hosting events in the community, you should have insurance to cover that. Conflict resolution is an important one to have ahead of time. So before there is conflict, you want to have a policy of how you will handle conflict. And that policy needs to lay out who has the final say, and where people can appeal decisions. So if you have two employees, or a contractor and employee, or a donor and a contractor, or your board chair has a disagreement with your treasurer, we need to have that laid out in a policy clearly, so that it's communicated to everyone who's affected by it, so that everybody knows the line where they should go if they have a conflict with someone. And there needs to be at least 2 layers of that. So if I have a conflict with someone else, it goes through the process of conflict resolution. We've had a mediation session with my superior. If I'm not happy with the outcome of that session, I should have another outlet. So having that policy written out as far as who is responsible, who has the final say, and where I can appeal decisions if I don't like them. That needs to be written out ahead of time before there's conflict, and that way it's clear to everybody. It's easier for conflict to not be personal that way. And oftentimes we can prevent conflict by having clear expectations that are clearly communicated. So annual practices and communications policy are the last 2 I want to talk about. Our annual practices should include evaluation of our programs, as well as an internal evaluation of our coalitions. We should have an annual report created, because when we do that, we can use that information from an annual report to garner more support, to build momentum in our community, to celebrate our successes, to reinforce ownership of coalition members in our mission and our vision. We should also, on a regular basis, evaluate the rest of these policies and our bylaws to make sure that they are still relevant, that they still meet our current needs, because our programs grow and evolve to meet the needs in our communities. So when we can evaluate on a regular basis what our practices are and our policies are, we'll stay relevant, we'll stay competent and responsive to what's going on in our communities. I do not suggest that you try to do all of that at once. It would be helpful to spread it out over the whole year, so that one month you're looking at your conflict resolution policy, another month you're looking at your employee handbook, another month you're looking at financial policies, and so that you spread it out, because I don't know anybody, and I'm sure there are some, but I don't know anybody who gets excited about reviewing policies. So encourage you to spread that out over the year so it doesn't become too onerous for anybody. So your annual practices don't all have to happen at once. Review also your membership contracts. So membership contracts are not formal typically. It's an agreement. It can also provide you with that updated contact information. You also want to make sure that you're meeting the needs of the people in your group. If someone joins your group because they're passionate about a specific topic, like youth homelessness, but you haven't ever addressed youth homelessness directly, you continue to talk about parenting classes and substance misuse prevention and suicide prevention, but you've never addressed that specific topic, you might have that conversation at an annual check-in with your board member or with your coalition member and realize I'm going to lose them if we don't start addressing their core issue. And that's an opportunity for you to check in with those members on a regular basis, and that's important. Finally, a communications policy. It's important to have a communications policy because you don't want people giving the wrong message. Communication is how you are represented in your community. It's the facts, it's the faces, it's the priorities. So when you have your annual strategic plan and you have identified priority areas, your communications should be reviewed before they get communicated to the public or board members. And so when you have a communications policy, you want at least 2 pairs of eyes to review anything before it goes out to the public. You want to make sure that it is following best practice for prevention ethics, for respecting people's privacy. If you have people participating in groups and you take pictures of them, are you following HIPAA guidelines? Do you have permission to share those images? If you're using quotes from people, do you have permission to quote them and use their name in your publications? So a communications policy doesn't need to be complex, but you do need to cover some of those basics. And every time you're communicating with anybody, and this is more of a practice than a policy, every time you're communicating with anybody, you want to reinforce why you're doing what you're doing. Oftentimes people, especially agency representatives, get into the grind of doing what they're told to do on a regular basis, checking the boxes. Every time you have the opportunity to connect with them and communicate with them, remind them of why they're doing what they're doing, thank them for the work they're doing, value them, and remind them that you are grateful that they're part of your group. And that builds the passion, that builds that ownership and the responsibility for shared outcomes. So I do want to share a couple specific resources where you can find examples of these bylaws and policies. So blueavocado.org, Michigan Nonprofit Association, and the Nonprofit Leadership Lab all have examples of these different policies that you can copy and paste and use and twist and tweak so that it fits your needs. But I don't want you to just think that you have to come up with all of these on your own. So that's all I have for tonight. I want to thank everybody for taking the time to watch this recording and wish you all happy holidays, and we'll see you next year.